peer review meeting quick.
Ready.
Let's talk about gout. We had a patient in room 7 with acute onset of pain in the first metatarsal joint. That is the most common site of podagra attacking first. It attacks any of the major joints, and it's usually the foot, ankle, but it can be the knee, it can be the fingers. People with chronic gout, you'll see some deformities. They're called tophi because of chronic uric acid retention, creates little bumps on their joints and things like that. The etiology of gout is because of uric acid retention and deposit of uric acid crystals. So some of these people will also have kidney disease and uric acid stones. So it tends to be like people like this gentleman had kidney stones in the past, so it might be that there were uric acid stones, and this would get in precipitation in different places. Interesting is how gout came from the name podagra. Podiatry is from foot. Podagra is a Greek god of the foot. And the Romans used to think that it was the Greek god of the foot way of attacking for bad behavior. Because usually people who would get an acute attack of gout happen after a party. And you know, the Romans used to binge on food, expensive food, and puke, and then eat and more expensive food. So cheese and wine, alcohol, different fancy foods, especially seafood and red meat, can precipitate uric acid crystals. So that's kind of how that came about to be called podagra when it's in the first joint of the foot, because the Greek god would attack them with this painful ailment because of bad behavior and binging on food. Treatment in the ER is mostly pain relief and then anti-inflammatories. You can do things like total inflammatories, of course narcotics for pain. And in terms of really treating the disorder, steroids, because it treats the inflammation of the joint itself, and colchicine. Now colchicine that was taken off, and now it's called Colchris, and it used to be taken like 1 tablet every hour until you get diarrhea. I'm just looking up how to give it now. It's just 2 tablets initially, you repeat it an hour later, and that's it. You only prescribe 3 pills of the Colchris or colchicine, because they found out doing this way too much, just renal problems and dehydration, all the things that are intolerable to patients. So 3 doses, 2 initially, 1 repeat, and then that's it. And then of course allopurinol, which is actually for prevention of gout rather than active treatment, is to keep the uric acids low. Of course, diet changes and things like that, lifestyle changes to things that precipitate gout. And then there's a new medication called uric that is more expensive but less side effects, and it's also meant to decrease your uric acid levels in blood, therefore your chance of having an acute gout attack. That's it.